I was in your province about 6 weeks ago, and first time in 50 years, and so lovely. Anybody wants to hire me, I'd move there in a minute. I just think you're the greatest, you guys. Um, anyways, everything you've been saying about COVID and everything is fantastic, very interesting. Um, what I'd like to do though is focus on the big fix section of my book. Oh, hang on, I'm getting a call here, am I? Are we good? Oh, here we go. Yes, you're not hearing me? I don't know. I've got, it should be working. People were saying they could hear me. Okay. Okay, so I'll hang up. Yeah. Okay, can you hear me now? So the Zoom people can hear me. Can the rest of you? Yep, thumbs up. Okay, very good. No, I was just saying I was in your lovely province about 6 weeks ago, and absolutely fantastic experience. And my wife and I loved it immensely. Anybody wants to hire me, I'll move there in a drop of a hat. What I really wanted to do here was focus on solutions. You know, it's as an old lobbyist, it's one thing to come to government with problems, but you'll set yourself apart by coming with solutions. So whether you agree with my solutions or not, it's meant to really help kickstart that adult conversation that we need so badly. And what I'll maybe do is, just before I get into what's called the big fix, my 10 solutions, I want to highlight what I think are three problems. So what's wrong with our healthcare system? First, when those in charge first started pondering how they might change the way healthcare was delivered back in the late 50s and early 60s, much of what they came up with was ideologically driven. Or to put it another way, borrowing modern medical lingo, it wasn't evidence-based. As is often the case when politics rears its ugly head, the process for creating good public policy can be hijacked by those with their own agenda, people who will stop at nothing to get their way. One of their tricks, straight out of the old spin doctor handbook, I'm afraid, is to substitute emotion for logic. In other words, they try to get decision makers to think with their hearts instead of with their heads. This is what I believe happened when today's healthcare system was being conceived. To make matters worse, no one involved in the original exercise, be it politicians, civil servants, or those leading the charge for the introduction of a publicly funded healthcare system, seem to be looking far enough ahead in the future. The second problem, and it's a big one, is that our healthcare system isn't really a system at all. It's an insurance scheme, and a badly run one at that. I mean, stop and think about it for a moment. How can we call it a healthcare system when so many things aren't covered, like eyes, for instance, or teeth? And don't get me started on the bean counters with their infuriating and frequently incoherent and inconsistent rules regarding what Medicare covers and what it doesn't. Furthermore, what kind of a system would allow patients, including some of our sickest and most vulnerable citizens, often seniors, to clog up the hallways of hospital emergency departments, all because our long-term care facilities are unable to accommodate them? The third problem with our healthcare system is a little harder to explain, but pretty much comes down to the fact that the Canada Health Act features 5 main principles: public administration, comprehensiveness, universality, portability, and accessibility. Notice what's missing? Quality. Nowhere do we measure, offer, or even seem to care about making sure that quality is part of our healthcare system here in Canada. Unlike the Ford Motor Company, whose famous commercial from the 1980s, and Ford Quality is Job One, touted the importance of caring about the quality of one's work. Those responsible for Medicare decided long ago that quality, at least when it comes to healthcare, is a frill, something we can all live without. Except, of course, we can't, because if quality doesn't matter, then neither do outcomes. which means that whether we survive an encounter with our healthcare system or not is irrelevant. A life lost is the same as a life saved, at least as far as the civil service is concerned, simply because the line gets shorter. This is why, when we're talking about properly diagnosing illnesses, ensuring patients receive treatment in a timely manner, and ultimately saving lives, one can't help but feeling that when it comes to Medicare in Canada, quality is job none. Yes, the healthcare doomsday clock is ticking, and we don't have the luxury of putting this off any longer, but there is hope. Here are 10 things we could do tomorrow to reinvent and ultimately fix Canada's healthcare system. So if I could get someone to put up the slide on the screen, the big fix for everyone to look at, that would be great. And what I'm going to do is run through each of these. I'll just give you the list in case you're not seeing it. So the big fix: number 1, stop lying to us. Number 2, put patients first, ideology second. Number 3, revise the Canada Health Act so that quality becomes the 6th principle. Number 4, combine all of Canada's provincial and territorial health ministries into one federal super ministry with one health minister. Number 5, stop focusing on illness and figure out how to keep us healthy instead. Number 6, open the door to medical tourism. Number 7, invest heavily in long-term care or be prepared to face the consequences. Number 8, bring back co-payments and user fees and introduce tax-free medical savings accounts. Number 9, allow Canadians to pay for the services we want by introducing a parallel private healthcare system and allow it to operate above board, the so-called hybrid solution. And number 10, fund it or free it. Okay, you're still hearing me. It's still working. Everybody's seeing what they need to see. Good. So let me continue. Now, I'll condense this as much as I can, and knowing that time is our enemy. It might be easy to blame politicians for the crisis we're facing, and I say it's wrong for us to go down that road. Although politicians have caused us an incredible amount of grief with their lies and deceit, the bigger problem, as far as I'm concerned, is the role Canada's doctors, nurses, and other healthcare professionals have played in the demise of our healthcare system. By propping up Medicare, by going the extra mile and sticking their collective fingers in every hole the dike has sprung, our healthcare heroes have in reality made things way worse. For you see, if they'd only sat back and let things fall apart, the way any sensible person would, then they'd have forced the hands of our elected officials, leaving them no choice but to do something about all this years ago. The other culprits, when it comes to perpetrating the big lie, not surprisingly, are the unions. Whether we're talking nurses or other healthcare providers, those who are unionized feel threatened by the likes of Dr. Brian Day and others who are pushing hard for the hybrid solution. However, the biggest impediment to the truth is us, we the people, each and every citizen of this great country. Judging by the way we keep voting in bad and deceitful governments, we're without a doubt addicted to the candy they keep bribing us with. You can see it every time election rolls around. They open up their wallets, they unlock the vaults, they start throwing money out the window, showering voters with pre-election goodies designed to fool us into believing they have our best interest at heart. If things are ever going to change, we must change. We have to stop letting candidates dupe us so easily. After all, as someone once said, if you don't stand for something, you'll fall for anything. So we'll go to number 2. Oh, hang on there. We're having trouble seeing my slides. Okay. Well, I'll just keep shouting out what would have been on the slide anyways. So number 2 on the big fix is put patients first, ideology second. So I got a list here. What could be done to make things better to actually put patients first? Here's a few tangible suggestions. Allow patients to choose where and from whom they wish to receive medical treatment. Allow doctors to deal directly with patients rather than forcing physicians to be constantly slowed down, weighed down by the swollen bureaucracies of provincial and territorial health ministries. Allow healthcare entities working outside of the government-sanctioned system more opportunity to provide services to patients. Reduce the number of healthcare civil servants, cutting any position that doesn't in some way directly support frontline care. Redirect the money saved from the elimination of these unnecessary positions so we can better fund basic healthcare services. Give doctors the power to plan and assist with implementing the changes needed to improve Canada's healthcare system. There is, of course, much more that could be done, but instituting these changes would go a long way toward making sure patients truly do come first. Now, Brian Day pointed out that originally there were eight principles of the Canada Health Care, or would have been 8 principles had they adopted all of Tommy Douglas's ideas. But my problem is that quality is not in there, and I'm suggesting it become a 6th principle. And you know, I just want to share with you what happened with me, where we're talking about quality. So I had been taken to the hospital as suffering from atrial fibrillation, and my heart was actually going quite wacky, and I was actually having a VTAC attack. So they were talking about putting in a pacemaker or something else, and they decided that, well, we could get tests, but there's going to be weeks to get tests. There's a wait list. I'm a sole source, sole breadwinner for my family, so I couldn't afford to wait in line for weeks in bed in the hospital. So I signed myself out. So here's the essence of it. When you're truly sick and facing a life-threatening situation, most of the time Canada's healthcare system has no equal. Imagine, for instance, that you're a race car driver at the Indianapolis 500 and you pull into the pits, where an incredible crew works on you, on your car, and gets you ready to go back out there. Everyone working in unison, everyone pulling together. That's our healthcare system at its best. Unfortunately, if it's not a life or death situation, if you're not about to expire, then our healthcare system is more like when a large Canadian city gets hit by a snowstorm, a really big one, say. Sure, highways and main streets get plowed within hours of the snow falling, but the side streets may not be touched for several days. And that's the problem with our system, is unless you have a life-threatening emergency, you're pretty much out to lunch. Number 4, and I know based on sitting and listening to everything the last couple of days, this is maybe a little controversial, but just hear me out on why I'm suggesting this. So I ask you, I'd say it's quiz time. How many ministries of health do we currently have in Canada? Believe it or not, the answer is 14. 10 provincial, 3 territorial, and 1 federal. Each province and territory has a health minister and a health ministry chock full of civil servants, most of whom never see a patient. That's a hell of a lot of dollars being spent on things other than frontline patient care. Imagine if we took all those bureaucracies and rolled them into one super ministry with 1 health minister and 1 bureaucracy, all located in Ottawa. The savings would be enormous. Now, I understand this would involve making changes to our constitution, and that would open up a whole bunch of problems. I'm suggesting, however, that just taking the example of pharmaceuticals, how much sense does it make to have all these different provincial and territorial health ministries negotiating separate deals with big pharma? Is it any wonder the cost of prescription medicines is eating up so much of our healthcare budgets? Surely the time has come for the piper to call the tune. The problem, of course, with doing that is that Quebec and maybe the West would suddenly want to dig into other issues that aren't related to healthcare. But I believe that combining the 13 provincials and territorial health ministries into one super ministry is an idea whose time has come. It would save us money, it would lead to efficiencies, and perhaps most important of all, it would allow for the kinds of creativity and innovation Canada's healthcare system so badly needs. And while the argument that I've been listening to over the last couple of days has a lot of merit, that provinces are able to innovate and do things, what doesn't happen is it doesn't get shared with the other provinces. This way, it might actually happen if we had a super ministry at the federal level. So another big one, number 5, stop focusing on illness and figure out how to keep us healthy instead. So I'm going to tell you a little funny story about me. Like most baby boomers, my days are filled with pills and potions, liniments and ointments, all meant to manage pain, which to varying degrees they mostly do. My knees are shot, my ankles feel like someone's constantly jabbing them with a Ginsu knife, and my back is always aching. When I try to stand up straight, I'm told I look like those pictures of J.D. Salinger just before he died. An old man, nearly 90 then, bent at the waist, looking at the ground like he was hoping to find some change. All that's bad enough, but I'm also 30 to 40 pounds overweight, and judging by the size of my gut, I appear to have swallowed a basketball while I was sleeping. It wasn't always this way, of course. Until I turned 40, I was mostly getting away with not exercising and eating, like someone bent on committing suicide with food. But then things started going wrong. First of all, during a routine checkup, it was discovered my blood pressure was 160 over 120. Then I was felled by kidney stones and shortly thereafter a hernia. A nutritionist at the hospital asked me a few weeks after the kidney stones were broken down and flushed out of my system about my diet. How much cheese do you eat? She wanted to know. I gave her my best guess. Is that a year, a month, or a week? She asked. A day, I responded sheepishly. I can't understand how you're still alive, she said, shaking her head. Me neither. Now, we had some talk about this yesterday. Let me just go into a little bit more detail. Open the door to medical tourism. I'm very much on top of this. Funny thing is, we seem to have no problem offering up our expertise and technologies to the rest of the world in other fields. So why do we suddenly get all queasy when we talk about doing the same thing when it comes to healthcare? We could actually bring money in. We could help our tourist sector as well. And if our leaders truly care about ensuring that Medicare is sustainable in the years to come, then embracing medical tourism could well be an excellent way to go about it. Of course, Canada wouldn't be Canada if we didn't keep coming up with new and inventive ways to miss an opportunity to miss an opportunity. Forget the beaver. Our country's national symbol should be the mule. We're so stubborn and intransient. Take Colleen Flood, for instance. Flood, a professor at the University of Ottawa, argues that allowing foreigners to pay for healthcare treatment in Canada might actually be a bad thing because it would make our access to care problems even worse for Canadians. Not content to stop there, Professor Flood goes on to suggest that any aggressive expansion of medical tourism in Canada would eventually have a negative effect on our public healthcare system by pulling doctors into the private system as a result of the irresistible lure of filthy foreign lucre. As usual, whenever the prophets of doom and gloom speak, my skin starts to crawl. It's like listening to the screech of fingernails on a chalkboard, as an unpleasant experience as I can think of. What I'd rather do is listen to people like Gwyn Morgan, who frequently writes on healthcare. In 2017, when talking about medical tourism, he said, "Herein lies an enormous economic opportunity. So-called medical tourism is a huge and growing business. Third world countries such as India and Thailand attract thousands of foreign customers, including Canadians. Removing prohibitions against private care would reverse the flow of money going to international private hospitals, better utilize our world-class healthcare professionals, and foster job-creating investment in one of the world's fastest growing sectors." I agree. I totally agree with that. Now, COVID's actually helped us tremendously in one way. It's pushed what I said would happen in 2030 right to our door right now, and in particular by shining such a spotlight on long-term care. So number 7, I say that we need to invest heavily in long-term care or be prepared to face the consequences. So I want to just focus on this, and again, in more detail. This is available in great detail in my book for those who wish to get it. This may hurt a bit, Reinventing Canada's Healthcare System. But listen to this one. This is really, really important. Researchers at the University of Waterloo and the Hamilton Niagara Haldeman Brant Community Care Center took a close look at the problem and discovered the following. This is the problem of bed blocking. Although patients whose discharge was delayed because of a lack of space in nursing homes accounted for only 9% of the total number of patients with delayed discharge, they accounted for an astonishing 40% of delayed discharge bed days. Or to put it another way, those waiting for admission to long-term care facilities represent a relatively small portion of bed blockers, but block those beds for a much longer time than the average patient does. These findings are important because they show in real terms the cost of not doing something about our long-term care problem. And the problem, of course, is that we don't have the right facilities. Now, one thing politicians will do is they'll try and solve the political problem. And so their idea of unblocking emergency rooms with because of bed blockers, they'll throw money to open up more rooms. But the issue is actually the long-term care. We don't have enough long-term care spaces. We don't have enough homes. They're not the right kind of homes. They don't offer the right services. And you know, until we get real about identifying the real problem, we're never going to get there. So number 8 of 10, and we heard a little bit about this earlier, bring back co-payments and user fees and introduce tax-free medical savings accounts. So I am a big believer in this. Now, let me just jump ahead. Why do we have to do this? Okay, a 2012 study by J.C. Herbert, Emery, David Still, and Thomas Cotterill shows just how impossible the task we're setting for our young people. The study calculates the average taxes paid for health services over a lifetime for a number of different age groups and compares that number to the amount of healthcare services used. So for Canadians born between 1958 and 1967, that's the baby boomers, that includes me, we'll eat up over $4,000 more in services than we will have paid in taxes. But the news gets worse. Those born between 1998 and 2007 will be required to pay over $18,000 more in taxes for healthcare than they'll use themselves. And those born between 2008 and 2017 will be asked to pay over $27,000 more. Even more frightening is this statistic. Peak taxes for Canadians born after 1988 are projected to be twice as high as peak taxes paid by the oldest of the baby boomers. Obviously, you know, those are not my numbers. Those are from a legitimate study. Our system is unsustainable. Now, I've just got 2 left here. Number 9, this to me is the big one, the holy grail. Allow Canadians to pay for the services we want by introducing a parallel private healthcare system and allowing it to operate above board, the so-called hybrid solution. Okay, so what's stopping us from allowing Canadians to pay for the services we want by introducing a parallel private healthcare system? First and foremost, fear of the unknown. It's human nature that people don't like surprises. I mean, look at how often people stay in bad relationships or re-elect bad governments. Better the devil you know, people are wont to say, than the devil you don't know. It's ludicrous, of course. Propping up a healthcare system that's unsustainable and frankly broken while refusing to take a serious look at innovation is not, in my opinion, a recipe for success. It's a recipe for disaster. And yet time and time again, Canadians embrace the status quo because bad as things are, at least with our public healthcare system, you know what you're getting. Fear that the less fortunate might be left behind. Every time I hear critics of hybrid healthcare talk about this, I have to laugh. No one is talking about improving the healthcare experience for the middle class at the expense of the poor and the disadvantaged. In fact, it's to everyone's advantage to ensure those at the bottom of the socioeconomic scale are well provided for. This tired old canard goes hand in hand with the next fear that so many Canadians might abandon our public health system for the private one, that our public system might worsen and fall apart. There are all kinds of checks and balances we can incorporate into a new made in Canada hybrid system, such as legislating a set number of hours a physician must work every month in the public system before switching over and seeing patients in the private one. That there's no way our current health system will collapse as a result of the introduction of a private system. The last and quite possibly most irrational fear is that allowing Canadians to pay for the services we want and introducing a private parallel health system will result in the loss of something that makes us Canadian. In fact, if anything, allowing for freedom and choice, last time I looked, is the most Canadian of Canadian values. Acting like a fascist, on the other hand, isn't something that should be tolerated here in Canada, either by our government or those who think nothing of lying to us. So number 10, fund it or free it, which could be this the slogan for everything I'm proposing here. So the 10 solutions I put forth, as I've taken great pains to point out, are, while controversial, nonetheless very doable. Politicians can stop lying to us. We can also stop lying to ourselves. They can put patients first and ideology second. It is possible for us to revise the Canada Health Act so that quality becomes the sixth principle. We can combine all of Canada's provincial and territorial health ministries into one federal super ministry with one health minister. Government has the wherewithal to stop focusing on illness and instead figure out how to keep us healthy. There is no reason we can't open the door to medical tourism. Canada has the resources right here, right now, to invest heavily in long-term care. With the wave of a wand, the government can bring back co-payments and user fees and introduce tax-free medical savings accounts. They can allow Canadians to pay for the services we want by introducing a parallel private healthcare system, the so-called hybrid solution, and allowing it to operate above board. And of course, those in charge are perfectly capable of funding our healthcare system or freeing it. So why don't they, which is the big question. It all comes down to perception, in my view. In politics, perception is not only more important than reality. Most will tell you the perception is reality. If I, as leader of X party, can convince the voters that you, as a leader of Y party, have a hidden agenda to put Medicare as we know it at risk by allowing change and innovation, thereby putting Canada on the slippery slope toward having a two-tier healthcare system, then I just might be able to demonize you enough in the minds of the electorate to win the next election. Unless you and your party are able to convince the voters that it is, in fact, I who have the hidden agenda, and that I'll be the one who paves the way for privatization of Canada's healthcare system by delisting services and making other changes to the fee schedule, and on and on and on. It's sick, it's perverse, it's disgusting, but it's the way the healthcare debate has been framed in our country for the past 60 years. So finally, I'm going to leave you with a few last words. Before we part ways, let me leave you with a story about the wise old man who is said to be able to answer any question. A young boy thought he could trick the sage, so he caught a bird and took it to him. Tell me, is the bird in my hands dead or alive? The wise old man replied, if I say the bird is alive, you'll close your hands and crush it to death. If, on the other hand, I say the bird is dead, you'll open your hands and it'll fly away. He paused for a bit and then smiled. The answer, he said, is in your hands. And last but not least, I've got this concept that had the pandemic not come along, might actually have been happening for real. So it's called the Institute for Healthcare Reform and Innovation. So I'm looking to find some investors to financially support this concept, something I'd hoped to get off the ground in 2020 before the pandemic struck and derailed all our plans. I also hope to write a sequel to my best-selling book, This May Hurt a Bit, Reinventing Canada's Healthcare System. The new one, you'll love the title. It's called If It Ain't Broke, Fix It, Myths, Barriers, and Breakthroughs in the 21st Century Healthcare, and we'll pick up where my first book took off. If interested, contact me at 416-859-2239 or via email at skyvington@bell.net.